I'm Kevin Price. Delighted to be with you for tonight's Price of Business. We got a lot to cover on today's program. Later on in the show, delighted to have, first of all, I got a great lineup throughout the entire show, but later on in the program, I've got Matt Patterson on. He wrote an incredible article entitled The Affirmative Action President. Incredible article that has created waves throughout the social network systems out there, Twitter, Facebook. We're going to be talking to him later on in the program, plus Matt Lewis over at the Daily Caller. Excellent article on really why Newt Gingrich has caught on, and I think it'll resonate with you as well. But in this first segment, as we're about to approach the holiday season, I want to encourage everyone out there to think about eating healthier, living healthier, and that's why I brought on tonight's guest, Dr. Debra Braverman, and she's going to talk about a healthy heart. How are you?
I'm fine. How are you?
Good. You've got a little bit of a warning out there for people. Holiday season for most began about a week or two ago with Thanksgiving, and you offer a little bit of caution going forward.
That's right. This time of year, we know that there's a marked increase in risk of heart attack from throughout December and into January. During the holiday season, whether you live north, south, east, or west, this is the time of year where people are at most risk in terms of heart disease.
Mm-hmm. And it's not only because of diet, although I'm sure that's part of it, but I think there's unique stresses that come during the holiday seasons that probably attributes to it as well.
Absolutely. Physical and emotional and psychological stresses of trying to get everything done and the shopping and having family in or traveling, preparing your home for guests. All of these things create a lot of stress and a lot of running around and activities, and that can precipitate incidences related to the heart.
Well, you offered a 5-point strategy. I'd like you to real quickly cover all 5 points. Let's take a little bit of time in dissecting a few of those. Go right ahead.
Well, first of all, you do need to be careful in terms of your diet and what you're eating. In particular, high-fat foods, they actually, a high-fat load in a meal can actually cause arterial spasm, which means closing of the arteries, and that can precipitate an event. Drinking more alcohol than you're used to. Alcohol has direct toxic effects on the heart, and that can cause irregular heart rhythms, which can lead to complications. A lot of salt, which can cause retaining of fluid, and if you have heart conditions, having excess salt and excess fluid retention can also put a lot of stress on the heart. We know that there are as we said, the physical and the emotional stresses, so having to control those and take your time and do the things that you can one step at a time. Also, watching your respiratory problems. This is the time of the year where there's infections and flus and this kind of thing. You want to be careful about protecting yourself in any ways that you can from getting any type of respiratory infection, which could predispose you to having a cardiac event. Even being near a fire, even just in your home, if you stand too close, actually there's fine particulates from the smoke, and they can lodge in your lungs and trigger either a blood clot or a heart attack. So it's recommended you stay 6 to 8 feet away from a burning fire. And these are all important things that we need to be paying attention to during this holiday season.
Okay, interesting. Yeah, obviously in the same vein of smoke, stop inhaling smoke through cigarettes as well. It might be a good time to work on that New Year's resolution today rather than waiting until January. And one of the things I thought was interesting is that you noted about the avoid obvious holiday heart attack triggers. Somehow people act like they can do things in December that they normally don't do the other 11 months. They don't normally haul trees around, and they don't normally, hang out in the outdoor cold, in ridiculously low temperatures for a long period of times. And they may not drink as excessively as they somehow do during the holidays. And so people need to not pretend that they've got some kind of hall pass, if you will, when it comes to living healthy during the holidays.
Absolutely.
So those are all very good advice. Tell us a little bit about yourself, about your practice as well.
Well, I specialize in a non-invasive treatment for heart disease known as ECP, or Enhanced External Counterpulsation, which is a very simple treatment. The patients lay down on a bed, and we take what amounts to oversized blood pressure cuffs. We wrap them around the legs, and in time to their heartbeat, these cuffs squeeze and release, stimulating blood flow. It's like exercise for those who don't want to or can't exercise, and we're getting that blood circulation with these cuffs, which creates the circulatory benefits of exercise in and around the heart. Helps to open up tiny little underutilized arteries and help them to mature and develop and become well established so that we can restore normal blood flow to the heart muscle.
Interesting. And obviously that non-invasive part is going to resonate with people. I think that when people think of heart issues, they think, automatically they've got to go under a knife, which is, I don't think anyone's excited about that.
No, absolutely not. In fact, most of my patients, that's one of the most delighted things that when they talk about the treatment, because there's no drugs, there's no needles, there's no surgery involved whatsoever.
Yeah, and it's obviously less costly, both in time and money. Certainly, I'm a big believer you should take as many steps as possible before you take the most invasive step. And so, obviously, on your road to trying to get better, this needs to be part of that protocol.
Absolutely, but even if you've already been down the road of surgery or stents or what have you, which most of our patients have, this is still at the back end of therapy. It's still a wonderful treatment approach for patients who've already had surgery. If they don't want to do that again, they know what they've gotten themselves into previously. This is another alternative for them to look forward to.
Yeah, now you're in the Philadelphia area, correct?
Yes.
Yeah, so do you work with other doctors around the country when it comes to this, or what have you got? One of my listeners is hearing you and saying, hey, I want to learn more about this.
Well, there's a wonderful website called Eecp.com, which can access information for patients and physicians alike all through the literature about what Eecp is about, and also help to locate treatment facilities in all parts of the United States.
Right. So you do have relations with other doctors or doctors who are familiar with your protocol.
Right.
All right, Dr. Debra Braverman. Give that website one more time, Dr. Braverman.
That's Eecp.com.
Eecp.com. Dr. Debra Braverman, thanks so much for being with us.
Thank you.
All right, do want to remind you, of course, the show continues 24/7. Great audio, video, articles, and more. Make sure you check it all out over there at priceofbusiness.com. While you're there, make sure you like us on Facebook and follow us on Twitter. More after this right here on The Price of Business.